State leaders say they're working now on a plan to improve communication between long-term care facilities and family members. This as the state health department still refuses to release the names of specific centers with confirmed coronavirus cases. Good evening. Thanks so much for joining us tonight live at 5. I'm Dan Spieler.
And I'm Fanchon Stinger. So glad you're with us tonight. Fox 59's Kelly Rinke has our top story. She has much more on families calling for transparency who say they are struggling just to get answers.
Families with loved ones in long-term care facilities are kept outside closed doors, relying on someone inside to keep them updated.
I have been trying for 3 weeks to get information through people I've talked to at the nursing home on the statistics, how many people actually had COVID.
Nick Wilden does not know what else to do. He is the power of attorney for his mom, who is living at Greenwood Meadows. He claims the facility only told him about 2 cases of COVID-19, yet he knows there must be more since his mom tested positive just recently.
No real answers. And even when I asked and follow-up calls after the first patient, when I would ask, it was sort of like, I don't want to answer that. They wouldn't come out and say it.
After repeated questions, Indiana now says it's working with state partners to develop a plan that follows recent federal guidelines.
The original CDC guidance that came out clearly asked all the long-term care facilities to identify one person in their facility who would be responsible for communicating the COVID status of that facility to families and to the residents.
Wilden says he's not having any luck, so he's reached out to the Ombudsman for long-term care for help. She's the state advocate for residents.
Why aren't you willing to force the nursing homes to share the statistics with people that have relatives?
The Ombudsman said on Tuesday those facility names should be revealed. And right now she's working with the state on a new plan for long-term care facilities that will be revealed on Monday. It will require the information be given to family members of residents and those who may be thinking about bringing their loved one to that facility.
I don't see a need for them to share every nursing home, but they should be upfront and have to disclose to the resident and the families the numbers.
He's not alone. One daughter of a resident at Willow Springs in Indianapolis claims she's having the same problem.
Frustrated doesn't even come close to the way I feel right now.
Terry King's 85-year-old mom lives here. She says she cannot get information from the facility about her mom, yet someone inside tells her the situation is not good.
Where my mom is on the first floor, they had cut off both ends, sealed them off with isolation. She said that isolation means coronavirus exposed.
For Fox 59 News, I'm Kelly Rinke.
Kelly, thank you. Now, we have reached out to the 2 companies that run these facilities. The Indianapolis location is working to get us some more information. We have not heard back from American Senior Communities, however, who operates that Greenwood facility.